this is a patient that was with a missing first bicuspid for a long time. And the patient comes to the clinic and says, oh, you know what, my sister is getting married in 2 weeks, I need a tooth. Only now became important. Never happened to you that, right? But it looks funny, but this is basically what we are doing here. Because the patient needs a tooth in 2 weeks, we are making a decision on a loading protocol based on a wedding parameter that we never studied for that. Right? No, but it's exactly that. But this is what the first recommendation said. If I place an implant in a healed site, the recommendation number 2, and I put a crown, it works. So that's what we did. And we were deliberating how we could do that, and I'm going to show you now a way that you can bring digital technology in a way that you can prepare that in advance for this case. So what we did, this is very simple. We take a cone beam CT for this patient. Then we did an implant virtual planning, which I will touch a little bit on that later on. And this is now the DICOM file in there with the virtual planning. We have a superimposition here of an STL file, which is the file that you obtain from a digital impression or from a model that you scanned. And you can see here a cross-section of this planning. And I'm really much enthusiastic about this technology because what I'm seeing now is that we have for once the possibility of virtually treat our patients and collecting all the information we need before going into the clinical intervention.